In some cases, the liver may be difficult to see from the subxiphoid position in a patient in dorsal recumbency because the patient has a stomach full of food or gas. In some narrow-chested breeds like Whippets, Collies, some Shepherds, and Dobermans, there is no room to maneuver the transducer at the subxiphoid position. In such a case, the transducer can be placed over the patient's rib spaces on the right or left side and in a sagittal or transverse position. You can place the transducer wherever it needs to be to see the liver. Rib shadows may partially obstruct the view in an intercostal approach. On the ultrasound screen, we begin in a ventral midline sagittal position, then move the transducer to a right lateral view between the ribs. The transducer is often close to the sternum for the best view between the ribs. The transducer can be sagittal or transverse. The transducer could also be placed over the left ribs wherever it needs to be to see the liver. Intercostal views may be necessary if the liver is very small or cirrhotic. With cirrhosis of the liver may only be seen from either the left or the right side between the ribs. For animals with a normal-sized or small liver, fine needle biopsies will need to be taken between the ribs. These patients will require anesthesia. The liver is larger on the patient's left side, so this is usually best to place the patient in right lateral recumbency. The liver can be viewed from a sagittal or transverse position, but for the biopsy, the transducer should be placed so that the ultrasound beam is between the ribs. The biopsy needle will also be introduced between the ribs. For right-sided liver lesions or obtaining a bile sample from the gallbladder, it may be best to approach from the patient's right side between the ribs. The patient can be placed in left lateral recumbency. Again, the liver can be viewed from a sagittal or transverse position, but for the biopsy, the transducer should be placed so that the ultrasound beam is between the ribs. The needle will also be placed between the patient's ribs. The right 10th intercostal view is used mainly in large or deep-chested dogs to view the right cranial abdominal structures, such as the portal hilus, aorta, caudal vena cava, and common bile duct. A right lateral intercostal approach from the last 3 or 4 intercostal spaces is used, and transducer pressure must be applied to collapse the lungs. The patient can be in dorsal or left lateral recumbency. If you have difficulty viewing the liver with the patient in dorsal recumbency, the patient can be allowed to stand or sit. The force of gravity will pull the liver ventrally and caudally, allowing a better view. The liver tends to push the stomach further caudally in standing or sitting positions.